President Cyril Ramaphosa has convened a special cabinet meeting for today to discuss ways of intensifying the battle against the coronavirus in South Africa. This as the number of confirmed cases increased to 38 yesterday. For more on today's cabinet meeting, we cross live to our colleague Samkele Maseko. He's at the Union Buildings in Pretoria. A very good morning to you, Samkele. What can you tell us about this meeting?
Well, Desiree, we've seen the president's convoy going into the Union Buildings. Just about 5-10 minutes ago, we saw that convoy that earlier on went to fetch the President of the Republic of South Africa, and the other convoy going to the residence of the Deputy President, going to fetch him as well. We are expecting the meeting to get and to commence at about, it should have even been commenced. It should have been about 10 o'clock this morning or about 10:30 later on this morning. But I'm going to bring in SABC political editor on what we should expect from this all-important cabinet and urgent cabinet meeting, one may say, that President Cyril Ramaphosa has called. Mr. Mbeje, what are some of the issues that will be ventilated in this particular urgent cabinet meeting that has been called?
Samkele, I think the Cabinet of South Africa and of course President Ramaphosa, they still have a window of opportunity to do something. Remember, the numbers in South Africa are still very low, so which means they can use that opportunity to implement measures. So one of the things that I think they should do as a matter of urgency is to look at the issue of public gatherings, because we know how this thing spreads. So if they then pronounce on what should be done to public gatherings. And my other issue that I think they can also look at, next week public schools will be closed. Perhaps they could also use that to say, instead of closing for 10 days, maybe let the schools be closed for a month, whilst the world is still trying to make sense of what to do with this thing. And the other issue really that is important, remember, all the cases that have been recorded in South Africa are from abroad. So the issue of travel must be enforced. So the travel from Europe particularly needs to be looked at. Otherwise, once it starts to spread within the country itself, it will be a big problem.
Mr. Mbeje, if you look at the travel issues of particularly of European countries, the EU and South Africa, the trade relations between the country, you bring in China where this pandemic started. They are arguably, both of them, the South Africa's two biggest trading partners when it comes to our economy. How will this particularly issue affect the trade relations of these countries? Looking at BRICS, Russia was one of the first countries within the BRICS formation to cancel any travel from China to Russia. Where does this leave South Africa?
Well, no doubt, Samkele, the economies of the world will be affected. So ours is not insulated from that. Ours will be affected as well. Another issue perhaps of discussion that the country must really look at, and this cabinet that is meeting here, the issue of the stimulus package. We've seen it in the US, we've seen it in UK, we've seen it at the EU. So we have to do it because the economy will be affected, but government must come up with measures that will try to mitigate. Yes, they will not be able to do everything, but at least it will send the right message to say they are aware of the implications of what is going to happen, but this is what they are doing. So I think, as I've said at the beginning, they still have a window of opportunity, but the time to act is now.
When it comes to acting, if you look at this particular virus, at this point in time, it's largely affected those who've got the means of production to basically able to travel to other foreign countries, whether to Dubai, to EU, to Asia. But once this virus then contacts those who are downtrodden, who are poor, whom the Minister of Transport, Fikile Mbalula, represents, those masses who travel through train, through taxis, through public transport, if this pandemic reaches the townships, the poor, what then happens?
That's where my fear is. Let's just make a very quick example, Samkele. Currently in Italy, where the hardest hit area is the richest part of Italy. They have all the facilities, but they are struggling to contain it. And we are talking about the first world country here. If you look at South Africa right now, people who've been bringing it are those who are well off, who are able to travel. Spare a thought, should it then go into the communities? Given the kind of measures that we have not done anything, so we'd obviously not be able to do anything. If you look at other African countries, for example, I saw Rwanda. They've been very quick. I think they've recorded 1 or 2 cases, but they've been very quick to say, well, no church gatherings, no big gatherings, because they want to contain this. In fact, I'm actually worried. We are approaching Easter. Those are generally characterized by large gatherings. ZCC, for example. this cabinet must be able to pronounce and give direction what should happen to those issues. Because if we say, well, the numbers are still low, I mean, you and I know that every day they keep rising. So we stand at 38 today, but I can tell you by the end of the day, we'll be up. So do you want to get to a level where it's unmanageable and then we act? No, it won't be possible. Let's act now whilst we can be able to try and mitigate it somehow.
You speak about acting. I know during January in Kimberley, you had a one-on-one sit-down with the president and you spoke about his leadership style, that he's not a dictatorial president. He will not make unilateral decisions. He's a consultative president. Does South Africa need someone who's going to consult at this point in time, or is going to stand up, lead the country and provide directive on where the country is going with this particular pandemic? How should the president be dealing with this matter? He's been criticized and chastised on Twitter of saying that he's not taking leadership on this particular issue.
In fact, I think he's been actually lucky. The fact that South Africa has been one of the countries that have been very slow in catching this virus has basically presented us, what I said again, a window of opportunity. So which means that kind of consultation that he does, so he should have been able to do it now. So this cabinet, South Africans are not expecting to say we're still going to consult further. So they're expecting him to come up with decisive leadership. In fact, if you remember that interview, he said, well, whilst I try to bring everybody on board, but when I take a decision, I take a decision. And then I think that's what we are waiting to see today. Because if he is not able to take a decision that really will set this situation apart, it will be very difficult to believe anything.
You go to Germany, Lufthansa Airlines, they've closed down about 27,000 flights back and forth. South Africa, our airline, South African Airways, is experiencing problems. There are other airlines coming in, particularly from the European countries, coming into the country, coming with this COVID-19 virus. What's the directive and the direction the cabinet should be taking, particularly when it comes to travel ban and curbing of the expanding of this virus?
You know, Samkele, one of the biggest casualties of this coronavirus will be the airline industry, no doubt about it, because they'll be directly affected. Unfortunately, we live in a global community, so this cabinet must be able to say thanks Lufthansa, thanks British Airways, thanks everyone who comes from Europe, because we have to contain it. So we don't have we don't have a cure yet. So the best cure at the moment is to contain it. And how does it come here? It comes via other people. So stop those. So the airline industry, unfortunately, will have to suffer, and they will be the biggest casualty after all of this. But we have to act, and the president and the cabinet must decide today.
On our last point, before we end the discussion, Mr. Mbeje, on the issue of the economy, our economy is growing at less than 1%, 0.3, 0.5, 0.6 maximum percent on average. Should a drastic decision to impose travel bans on those coming from European countries and other countries affected by this particular virus, where does that leave the South African economy at growing at the rate at which is envisioned in the National Development Plan and in the vision of the President in the stimulus package that is spoken about, and in the State of the Nation address, and in the budget speech delivered by Minister Tito Mboweni, the Minister of Finance?
One of the things that we've said about this virus is that it has changed completely the global outlook, economically and otherwise. Of course, we'll suffer economically. In fact, we can even go into a recession. But we'll not be the only ones because everyone else is suffering. That is why governments are trying to help and mitigate. But in our case, I think the Reserve Bank, I know they are meeting on Thursday. So the best thing they can do for South Africans is to try and cut the interest rates, because we are trying to somehow encourage people to spend a bit of money so that your economy can be alive. And then the stimulus package that we have spoken about. But basically, when it comes to the economy, it will be severely affected, and it's not going to be the isolated economy of ours. Everyone will be affected. So somehow we'll have to rearrange the global architecture of the economic outlook post-coronavirus.
The Minister of Health, Dr. Zwelini Mkhize, has been very hands-on and on the ball on this particular COVID-19 virus. Going into this meeting, what kind of report can we expect him to table to the President and to the extended cabinet on the work they've done and the measures that could be taken in place to avoid the virus from spreading, and measures that need to be taken?
As the Minister, who is also a doctor, he should be very honest with his colleagues to say, yes, we are still lucky that the numbers aren't up yet. But so that we don't get to a situation of Spain, a situation of Italy, a situation of Iran and China, let's act now. I mean, you'd remember that in Italy, for example, which is now the epicenter, by the way, I think around the 21st of February, the cases were not even in their hundreds. So we are in March now. There are more than 20,000. In terms of death, 1,500 deaths. So why? Because they took it lightly. We'll be able to contain it. So the medical doctor, in the form of the minister, Mkhize, should be able to share with his cabinet colleagues to say there are serious dangers here. We need to act. Yes, in the immediate, there'll be a lot of sacrifices that we'll have to do, but it's for the better future. What's the point of saying, no, we are trying to secure the economy, when the people who are supposed to work the economy will die?
Mr. Mbeje, as a sports fanatic, a soccer fanatic, this weekend all rugby games have been suspended, the Super Rugby. Those who largely support and know the demographics and the socio-economic conditions of the country will know that rugby fans are largely the ones whom are able to afford certain things and are able to travel. Soccer is still going ahead. Where does this leave the sporting fraternity? The Cape Town Jazz Festival has been cancelled. The Iron Man has been cancelled. Where does this leave those that we may perceive as entertainment for us?
Unfortunately, we have to suffer. You know, there's a game that is coming. In fact, it will be here in Pretoria on Tuesday, Sundowns and Pirates. And, you know, that game is a decider. And I think government needs to act because there'll be large crowds. And those crowds, that's where the danger is. I mean, if you look at what's happening in Europe, I mean, everything has been cancelled. So what is stopping us? Let's cancel them. I mean, if we cancel it, we are saving ourselves. Then saying, no, we're going ahead, and then we contract this virus in our numbers, and then, of course, we die. I mean, what's the point?
Thank you very much, Mr. Mbeje. In fact, that game is at Loftus Versfeld, where Mamelodi Sundowns will be going head-to-head with Orlando Pirates. But South Africans are waiting with anticipated breath to know if indeed what measures will be taken by the South African government come the end of this all-important cabinet meeting, where President Cyril Ramaphosa has indeed arrived to co-chair that particular meeting with his deputy president of the republic, that would be David Dabete Mabuza. Just then, to bring in Mzwandile Mpecho on one last point, can we expect the president to address the nation today, or will it be Dr. Zwelini Mkhize, Minister of Health?
It has to be the president. Dr. Mkhize could be around, obviously, to give us an update on the medical issues and what is happening. But in terms of giving the direction, remember, this is the commander-in-chief entrusted with all the responsibilities of taking care of this country called South Africa. If a decision that is major is to be communicated, it can only be communicated by one man and one man only, the President of the Republic, Cyril Ramaphosa.
That was Mzwandile Mbeje saying, well, we can anticipate that the president will address the nation. In most cases that I've covered in my short career and his many years in the field, whenever the meeting is at the Union buildings and it's an urgent one, first of its kind in post-apartheid South Africa, that as such an urgent cabinet meeting has been called. And if there are any pressing matters, it is always finished and closed with the Commander-in-Chief of the Armed Forces and the President of the Republic addressing the nation later on that particular evening or afternoon.
It's an important conversation because there have been questions being asked about decisiveness in terms of government. Samkele, thank you so much for that update.